Hello, I'm Dr. John Owings, and welcome to the Health Insider Podcast. I'm located here in Grand Rapids, broadcasting from my clinic at Advanced Integrative Health Center, which sponsors the show, Integrative Health Podcast. Here in this show, we're going to explore all things health and wellness related that tie to longevity, and we're going to explore topics that deal with conditions that people have, like bad knees, bad shoulders, failed surgeries, neuropathy, type 2 diabetes, thyroid problems, liver problems, heart problems, neurometabolic issues. I want to explore all these topics so people understand that integrative health is the way to go. It is a way to change your life. It is a way to improve the quality of life. It is a way to improve your health span and ties your lifespan so that you can live a life without limits, live to 100, live pain-free, drug-free, and disability-free. First podcast that we're going to start with is going to be a common condition that I see quite frequently here in Grand Rapids, and that is going to be the issues of neuropathy. It's a hot topic right now, you see it all over. There's a lot of different types of neuropathy we can talk about, from neuropathies from stenosis in the spine, where you get a narrowing of the canal, where the nerves are getting trapped. You've got neuropathies that from cancer type neuropathies from chemotherapy. My main focus is going to be on neuropathies from lifestyle, type 2 diabetes. This one we see frequently. And let's explore some of the type 2 diabetic problems that lead to neuropathy. Neuropathy is not a condition that you're born with. It's actually one that you develop, especially type 2 diabetics. That comes from the issue of the inflammation that comes from sugar, lack of exercise. And when you start pooling these problems together with poor dietary choices, of course, neurons need nutrition to heal. My brain's getting overflowed here. So when we're looking at neuropathy, we need to address a lifestyle issues. And frequently when I see type 2 diabetes coming in with neuropathy, those two conditions are so married together. It's unfortunate that patients, they really don't understand it, and they don't understand how to fix it. Of course, by the time they get to me, we're the last stage because they've been to the medical doctors, and the medical model really doesn't have a solution for it. Their solutions are drug therapies. And there's a few they use. You can look them up, from gabapentins, Neurontin, but it doesn't actually solve the problem. You can take a drug and buy you time, but ultimately neuropathy from type 2 diabetes is really a lifestyle problem. It's not understanding that the food that you eat matters, that the exercise you're not getting matters, that the fluids that you're drinking matter. And so let's peel those back. Typically, we see neuropathy coming in, a person can be 40, 50, 60 pounds overweight. I'm honestly never met a type 2 diabetic neuropathy patient that wasn't overweight. They're out there. But the vast majority of neuropathy patients we see are type 2 diabetics. Their lifestyle is not moving. They're eating a lot of bread and pastas and gluten and dairy. And gluten and dairy are pro-inflammagens to the body. It cross-reacts to tissue types, and it creates a lot of inflammation. And the thing about inflammation is it's non-specific. Yeah. Sure.
What would you say the main causes of neuropathy are, and would we be talking genetics, lifestyle, or other conditions like diabetes?
Okay. So some of the main causes of neuropathy, I would say the primary cause for neuropathy we see in the clinic is going to actually be type 2 diabetes that's related to lifestyle problems. Now, most of us know that type 2 diabetes is actually a blood sugar problem, and it is. You dysregulate the insulin, the glucose, and it starts creating a cascade of events in the body that create inflammation. Now, this is where people, I think, struggle because the medical model doesn't, and people aren't really aware of what actually inflammation is and why it's so dangerous. So let's talk about what inflammation is and segue back to type 2 diabetics, and then we can move into the neuropathy issues that it causes. So inflammation, we all have it. You recognize inflammation, so when you cut your finger, it would get red and then swell a little bit. Those are all aspects of the inflammation process. It would get tender as it heals. You'll see a scab form of it. But there's other types too, where you can stub a toe and not necessarily hurt it, but you can bruise the bone and, from smacking your toe or something, and it'll hurt for a few days. That's an inflammation process too. And you have this immune system, has two branches. You have your innate immune system and you have your adaptive immune system. Your innate immune system is kind of your police. They're just all over the body and they're searching for problems that are hiding out. And they respond when there's a signal that says, hey, we have a bacteria over here. Or in some cases, we call those antigens. Something is causing the body to take awareness, and the different types of lymphocytes and neutrophils and macrophages will move to the area to start working on a problem. And if it's working well, you have an immune system that comes up, attacks the problem, and then you have resolution of the immune phase, of the inflammation phase. If it's not working so well, the immune system can be overpowering to the body, and it can resolve too fast, leading to chronic inflammation processes and chronic infections. Those are talks we can have later. But the main thing is that inflammation at the tissue sites is a signal to the body that we have a problem. And it releases all these chemicals and they have a lot of different names. They go from cytokines. These cytokines have subsets of names called interleukin 6, interleukin 8, tumor necrosis factor. The list is huge because they're all chemical signatures or messengers telling the body, hey, come over here. Now, some of those cytokines are pro-inflammatory and some are anti-inflammatory, means they move the inflammation towards resolution. The problem with type 2 diabetics is that we can start gaining weight, we can start imbalancing sugar and insulin issues. The body can't move electrolytes around the way it's supposed to. The inflammation of body fat actually increases its own, even extra body fat that we can carry as type 2 diabetics are overweight. Actually, the adipocytes release their own forms of inflammation. And then these cytokines, the hardest part for people to grasp is that these cytokines are systemically inflammatory, which means they don't care where they go. They move from the site of where the infection is or where an organ might be having a problem, and then they spread and they ubiquitously through the entire body. Nothing controls them. They just go wherever they need to go. And then other tissue have sites that they can lock onto, and neurons carry binding sites for these different cytokines. Well, eventually, over time, you start getting this low-grade inflammation that never goes away because of lifestyle, eating habits, smoking, too much alcohol. You can get fatty liver disease. That's an inflammatory process. You type 2 diabetics, you put on weight, that's an inflammatory process. Sedentary lifestyle, not moving, that's an inflammatory process. Then the cells, normal cell function can't occur correctly. Cells die prematurely. The pathways that clean up cell function can't operate correctly. You get abnormal cell death. It's an inflammation process. And pretty soon, you have these cascades of events going through the body of inflammation that's out of control, of which is stuff we can actually measure on labs now. And we'll talk sometime about metabolic vulnerability index. It's a great lab test that we can see low-grade chronic inflammation that may not show up on other blood work. But the problem is that when we have this chronic inflammation, it hit the nerves. And then the nerves will actually become inflamed, and then they start to die. And they start losing their sensory feedback. And now it starts with a light tingle in the foot. And pretty soon you lose sensation as the nerves shut down. And it can be painful along the way. And so this is where we see neuropathies coming in. And so when we're looking at neuropathy cases, you can't just go and do a therapy for the neuropathy. You actually have to look at what the whole body's doing. You have to unpack the story and re-engineer multiple aspects of this body to get this neuropathy to even get the healing to occur. Because, a nerve needs stimulation to begin healing. It needs oxygen to heal, and it needs the right amount of glucose to heal. And if it's not getting that in a correct format, it just dies. And so these are some of the topics that we have to deal with neuropathy, that you have to address these lifestyle issues and get the person moving, clean up the diet, intermittent fasting. Intermittent fasting is how the body starts to rest. And that's a topic we can spend a lot of time on. Let's explore a little bit what intermittent fasting means and how we can leverage it for longevity purposes. And, there's lots of clinical studies out there where they work on mice that restrict diets and they show a 20% increase in lifespan. And the same somewhat applies to humans, in that when we do intermittent fasting, the preferred method that I like to do is, 16-hour fast where I'm eating lunch and dinner and I don't eat until the following afternoon, the next day. The benefits of fasting, if it fits the person, I'm not saying everybody go out and do this, but if it fits the person, there are different types we can talk about. But it begins to allow the body to rest. Eating takes energy. Eating all the time takes even more energy. And in today's modern world, unless you're a high-end peak performance athlete, you don't need to eat all the time. You just need good quality food. 2 meals a day, rich in nutrition, small amounts of protein to support your muscle mass. And the body needs time to rest so that it can clean up cellular debris, so it can clean up the process of eating. So it has time to clean house. Just like you have your own house, if you just constantly go, and never take the time to spend inside the house, your house will get cluttered and dirty. The same thing happens to our body if we push it, work, feed it, but never stop and never take time to rest and don't have good sleep. Eventually, your body says, hey, I've had enough, and it'll start to react negatively. And you can see that in changes in biochemistry through changes in hormone pathways, to alterations in blood sugar and insulin, changes in thyroid. These are all just simple signatures the body says, I've had enough. And then throw in insults from sodas and cigarettes and pollutants. Pretty soon your body's stressed out and doesn't even know what to do anymore. That intermittent fasting and resting allows the body to clean house, which is an anti-inflammatory effect. And this allows the time with the right stimulation to the neurons, whether we're using electrical stimulation or laser therapy, combination of all of them, we can begin to regenerate the body and regenerate the neurons to get them to start firing and thereby start relieving some of the symptoms of neuropathy. But I have learned in the past that you can't do it with just therapy. You have to address the lifestyle issues as well. Otherwise, it never heals very well, or you get a little bit of healing, but it never stays. And the objective of good functional medicine and good lifespan is to make sure that your therapies that you're doing have lasting effects. Because the most expensive therapies are the therapies that don't work. And I see all that too often. Other clinics that I've seen where they're treating therapy, but they're not doing any really real deep lifestyle management. And if you really want to change the outcomes of neuropathy, and you really want to change, because if you're going to have a neuropathy patient, you might as well handle the type 2 diabetics, and most of them are, we begin addressing the lifestyle issues for them. And they change.
One of the questions we have in here a lot is that neuropathy cannot be reversed. Is that true?
I hear a lot of questions coming in from patients when they first start in the clinic that the doctor told me that neuropathy can't be fixed, that it's just a lifestyle, it's the way it is. And I'm going to stand firm that that is not true. The only reason why a medical doctor says that is because, so the medical world largely lives in the insurance world. The insurance world is a ran-for-profit industry. So if you own your own company, you want to be profitable. So if you're an insurance company with whatever, brand name XYZ, and you have thousands of shareholders and a board, they want to be profitable. So in order to be profitable, you can't allow therapies. You're not going to pay for every single thing that comes out that may work. You're going to go often with the cheapest healthcare, the cheapest solution that might be a solution. Might even be a solution, just might make the patient feel better. So they're going to go to drug therapy. How much does a drug cost? What's being said by professionals is they said we have XYZ drug we can give you. But these drugs are used because they're inexpensive. They don't cost that much to make. And so from the medical model, an MD who's buried deep in that model, works for the hospital, he's only allowed to use the drug therapy and maybe some physical therapy, but they're not going to have access to PMF machines, to different types of lasers, to units that we use here called a HOCMed that we can actually help some nerve regeneration pathways, or any number of different types of therapies we can use here. They're not going to have access to it. So since they don't have access to it, they're not exposed to it. So in their eyes, there's nothing they can do. So I hear it all the time where a person comes in, my doctor says I have neuropathy, there's nothing they can do, and do some physical therapy. That didn't work. And I'm taking this drug and nothing's happening. Well, my position is a drug shouldn't do anything because you don't have a drug deficiency. What you have is a sugar problem, an insulin problem, and dying nerves and a dying body. So if we go with that assumption and say, okay, why don't we start fixing the diet, getting the intermittent fasting going, getting the nutrition back into the body, and do things that we know have been shown to regenerate a nerve, and there's nutrition out there, and get anti-inflammatory reagents going. So and I'll show some names out there. What are common anti-inflammatory things that we can use? Turmeric, resveratrol. Chronic inflammation also creates problems with these things. They're called reactive oxygen species. So what's a reactive oxygen species? Anytime you're squelching inflammation, you're going to make oxygen as a byproduct of a lot of these reactions. The body has to clean that up because that's dangerous too. And so its primary MOP is this molecule called glutathione. Well, when you have chronic inflammation, your glutathione levels can become exhausted. And so part of the solutions that we use here, or the help that we're using here for patients, is replenish glutathione. Get things like resveratrol, turmeric in place. Elevate the vitamin D. Add essential fatty acids, because essential fatty acids make compounds called resolvins that decrease inflammation processes. This allows the body to go and start rebuilding and rehealing itself. And so when I hear that there is no options for neuropathy, I know a patient's confused, and that's the medical model. They're not exposed to this information, or they choose not to be exposed to the information, or in today's modern world with the internet and the availability of resources to us, I don't tolerate willful ignorance anymore. They're choosing not to learn. That in itself is its own problem. I think all doctors should be open to learning, and the medical model is really heavily into, don't get me wrong, there's been some wonderful advances in medicine that saves lives all day long. But the general practice of medicine, of just drug therapy, is not healthcare. What we're trying to do is move healthcare along. With integrative health, is to say, what are all the options we have to us? We're not beholden to the pharmaceutical industry. We don't have any beholding to insurance industries. Everything we do can be cash basis. The patient can choose what they want. And we can begin integrating these therapies that begin changing lives for people and taking out these type 2 diabetics and reverse type 2 diabetes, reverse the neuropathies, shed the weight, and change people's lives.
What are some of the first signs or symptoms people should look for when it comes to neuropathy, would you say?
So I get asked this question, there are early signs and symptoms. I would say this as that light tingling that starts but then goes away. And then all of a sudden it moves to another one where it becomes a little more persistent. And that's when people start seeking care, is it starts to happen all the time. Their feet will start to tingle, it'll move to the hands, then it'll happen more frequently. Then they'll start taking the medications for it. And here's where it gets bad. And it helps, in a normal response, when the nerve starts to die, the tingling stops. Now this is where we have a problem, because now they think it's going away, when in fact, they've actually lost function to the point where they can no longer, and then they start not feeling their feet. That's when you can get hurt, you can fall. And those are some of but the early signs is just intermittent tingling that they can't figure out where it's coming from. So some people will start with the chiropractic care because they have tingling, but then it doesn't really solve the problem. It becomes more frequently. And that's when based on lifestyle, things we can look at, and blood tests will show that things like A1C is going up, insulin is going up, fasting glucose is going up, all pointing towards that diabetic problem. And then with the numbness and tingling in the feet, early tingling that they feel, that's where you start having the early signs of neuropathy. And those are good times to actually start intervention and start looking at lifestyle. Because once you start fixing the lifestyle, remember, you're adding quality and quantity of life. And that's very important that we make sure that as an aging process, we have a health span. And if our health span drops decades before our lifespan, the quality of life starts to diminish. And now you start developing more and more. Well, what is it? 40-some% of the population has one chronic illness. And by the time they're mid-60s, they have 2 and 3 chronic illnesses, which is really unfortunate because it shouldn't be that way. So,
can untreated neuropathy lead to more serious complications?
Yeah, so an untreated neuropathy. I see this one come in every once in a while. Let's go a bigger picture. So we tend to say, hey, doc, I have this neuropathy. I can't feel my feet. I do the exam. They can't feel their feet. The feet are cold. I have infrared cameras. We can look at it, and we see the feet are being blue. And then I've seen some patients fixate, I got to get my neuropathy back and get rid of it. I've got to get rid of the neuropathy so I can feel my feet and walk. But see, that's just an outward sign of a much deeper problem. Because the longer a neuropathy sits there, we have to understand that neuropathy to occur is an inflammatory process. So if I'm going to deal with a neuropathy, I have to deal with what other inflammation is going on that we don't know about, which is why we run the type of labs we do. One company I love to use is Cyrex Labs. Cyrex Labs has these arrays. One particular is Array 5, which is an autoimmune panel. Array 2 and 3 are for gluten and leaky gut panels. By diving into these, we can begin seeing other hidden issues that are going on that drive inflammation. And the problem with neuropathy, as it sits there and does its damage, we have to realize that the damage is also being done potentially to the liver, potentially to the heart, potentially to the thyroid, or the GI tract. And these low-grade chronic inflammation at all these locations, the body has to deal with. And if this chronic inflammation continues to burn, what do you think happens when it hits the brain? We all know those terms. We call it dementia, Alzheimer's, Parkinson's, frontal temporal demise, what Bruce Willis has. These are all inflammatory conditions that occur because of chronic inflammation. They use different pathways to get there, but the tissue destruction is tissue destruction. The body has to clean it up. It can't. It's running on our reserves. Inflammation just keeps cascading. As we get older, the medical model keeps giving more and more prescriptions for all different problems. And this is what you see. These problems are just getting deeper and deeper. Now, the next problem, another problem that I see that I really take seriously is that diabetic neuropathies can also have effects on the eyes. And so in this clinic, Advanced Integrative Health Center, we actually look at the eyes. We have a device called a right eye where we look at saccades, pursuits, fixations. I look at how well your eyes are actually functioning, because the eyes are one of the few organs that integrate to the entire brain, to most pathways in the brain, because we need our eyes to make all kinds of decisions, to walk, to move, what we smell. We can look towards things, we can hear a name, we can turn. All these pathways are integrated to our eyes, as well as balance and walking. So some of the problems we have is if you're not even taking in the world correctly because your eyes are being damaged, which is also inflammation, the body sees it as a threat. The body sees it as a threat, it's going to change how you walk, how you perceive motion. And so some of the people have an inability to feel when they walk. They can't see very well when they walk and they fall. So if you are walking normally and you fall at a certain age group beyond 60, you have the chances of losing a metric of movement, which means you go from walking to need a cane. If you fall with a cane, there's a 50% chance, if I got the numbers right, that you go from needing a cane to needing a walker. And from needing a walker, needing a wheelchair. Past 70, if you break something on a fall, you have a 30% chance of not even being alive in the next year. If you can't, untreated conditions from the neuropathy, because of the inflammation, creates other long-term health issues. Like you can have heart issues, you can have fatty liver problems, you can disrupt the eyes and create vision problems. Vision problems alone create balance issues. Balance issues lead to falling. Some of the research shows that if you fall, you have a 50% chance of needing a cane later on. If you fall with a cane, you need a walker. If you fall with a walker, there's another 50% chance you need a wheelchair. See, all these issues have stacking health concerns that we need to be mindful of. And some of the best outcomes is we address all the metrics that we can. Your eating habits, your drinking habits, your walking, exercise habits. If you want to live a long time, you have to eat well, you have to drink well, you have to think well, you have to play well, you have to be well. And what does all that mean? And that all has to be explored and understood so that, if you're a senior and you have kids or grandkids, you want to be alive to see them. But you also want to be alive with a quality of health and a quality of life so you can do things with everybody and not be a burden. Because of the big number one complaint in research, some of the biggest problems that we see with seniors when you lose mobility is also the loss of independence. And that's kind of in research, that's a big fear for older folks, our seniors, is that loss of independence. Because when we lose our independence and we lose our ability to move, mobility, because we're confined to walkers or we're confined to wheelchairs, we can't get out and do stuff, now you can become frail. And frailty is a big problem because when you're frail, you really are at a very weakened state. You've lost muscle mass because you can't move. You've lost vital lung capacity for breathing and straining the body a little bit. So now you have oxygen exchange issues going on, and all this stacks against you. And being frail is the end game is not very good for a person. If we're going to be frail, let's be frail. When we're 98, 99, but we live to be we live 6 more months or 3 or 4 more months, but not years of frailty, but a few months of frailty. The goal is to have a strong body, to be able to be in our 70s and still climb a flight of stairs and not be winded, to have a muscle mass because we're exercising, we're walking, we're eating well. And that's a body that will live a long time and resist disease and stay healthy and mobile. And that's very important as we get older.
Are there real stories of patients currently right now who've experienced life-changing results that you can maybe share with us?
Yeah. We always have hopes that it works for everybody. It doesn't always work for everybody. But all I can do is, truthfully, I can do my best work. I'm not responsible for what you do at home. And I have to be honest with people when I get this question. You have to do your due diligence. But I would consistently say, when people ask me, I can give them plenty of patients. Where we typically see, I've got one that comes to mind right now, high blood pressure, cholesterol through the roof. And in the course of 10 weeks, he dropped close to 30 pounds, and all the signs and symptoms of the problems he was having all went away. It's a simple story because, frankly, some of this isn't that hard. When you understand where the problems come from, you can make crazy changes very quickly because the body doesn't want to be sick. If we look at this planet has been circling the sun for 3 billion years, and putting religious viewpoints aside, just go with evolutionary history. You've got a genome that's shaped by 3 billion years of evolution, whose ideas, if you look at Darwinian genetics, it says survival of the species, the fittest. We are at the top of the food chain, designed to be healthy, engineered to be healthy, with a genome that's strong and healthy. It doesn't want to be dead. It wants to be alive. So you get these wonderful changes with people. And very quickly, when you understand where the problems are coming from. I got another patient that he started last year. I've got another one I think about too, that really started as a chiropractic patient, was having really the classic weight gain issues, cardiac issues, diabetic issues, type 2 diabetic issues. It's all there. And in the course of a year, he has dropped 75 pounds, cleaned up the diet, did all the blood tests, did all the labs. We really put together a good functional model of what was going on, and he owned it. And that's the key to success, is you have to own it. I can't own it for the patient. I can't own it for you. You have to own it yourself. My job as a coach, my job as a doctor, is to be a teacher, a guide. I grew up in Alaska, and big game hunting is pretty popular. Moose, caribou, elk, brown bear, black bear. By state law, you have to have a guide if you're out of state. What would be the point of you spending $5,000 to go moose hunting, and the guide takes you, okay, we're going to go over here, and you say, no, I'm going to do my thing over here. The guide's going to say, but the moose are over here. Yeah, but I want to go over here. See, that doesn't work. So my job is to be a guide for a patient, to show you and teach you. You don't know what you don't know because you don't know it. And I've got to show you where you're going wrong based on science that we know, and apply it so that you can get the results you're looking for. I can think of another lady, literally in the course of 2 years, she's lost one of herself. She has a mini-me. Literally, she's down to 150 pounds, and when she came in, she was 300. She lost an entire body. And that was a 2-year process. She was extremely ill. And again, the medical model, we don't know what's going on with you. You really don't know what's happening. And that was when, we ran the labs. We showed the inflammation processes. We went after them. We cleaned up the diet. We did intermittent fasting. She started exercising, lifting weights, and her body just started shrinking. And I think to this day, she's 150. I think she's last check-in was 150. She's done work. I mean, she doesn't have plenty more weight to lose. She's where she needs to be in a healthy way. So those are kind of the real world changes you see. And of course, all the associated problems with the type 2 diabetes and all the inflammation tends to go away. Can we say that we fix a person 100% all the time? No, because sometimes there's been damage to the organs. We have to be mindful of that. Sometimes people do get broken. It does happen. And that's where, as a clinician, I enjoy working with an MD who can maybe reduce medications for a patient, but they still might need some, depending on the situation. I'm okay with that because my way isn't the only way, and a medical doctor's way shouldn't be the only way. If it's not necessary, it should be teamwork, where he can do the pharmaceuticals if we need it. I can do the lifestyle interventions. We can work together as a team, improving the quality and quantity of life for that patient so they get the results of metabolic changes, that maybe they need less high blood pressure medications. They need less medications for the type 2 diabetes, or maybe they can come off the stuff. We've seen that happen. So that's what we're trying to accomplish here.
Awesome. Another question I do have, and this is a great question, is what does your approach at Integrative Health do differently compared to standard treatment?
I get asked a lot in interviews, new patients coming in. I've been to a lot of different doctors. Why are you different? Why should I invest my time, energy, and money into this clinic? Really, it starts what's different. Sadly, I don't know why this is, but it starts with the exam. And I have had, and it segues into the next process. It segues into starts with the fact that we do a neurological workup. I assess the eyes, I assess the eyes with the right eye, which is saccades, pursuits, fixations. How well are your eyes working? We look at the cerebellum. How well is it working? Look at the brainstem. How well is it working? We look at the sensory system, hands, feet. How well are they working? And the sad part is, I've asked many people, well, tell me what the medical doctor did or the other chiropractor did. And they look at me like, you're the only one who's ever done this level of exam. So our first start is, what is the exam actually telling us where the problems might be coming from? Now, what radically sets us apart to the learning that I've done and through other doctors I've trained with is the fact that we go after the labs in a different way. The medical model is constrained by what the insurance says is, here's what you need, this is all you need. And the labs are actually very, very narrow. In reality, what you really need is a full cascade of a lot of different pathways so you can get a big clinical picture, which means full thyroid panels, which is about 7 different molecules for the thyroid, not just TSH and, T4. You have to do the whole thing, a full iron panel and all of its components. And then part of my blood work is looking at the blood work for what your B vitamins are doing, like B6, B12, folate. We look at markers for inflammation. There are classical ones that you can look like C-reactive protein, ferritin. These are primary phase reactants. But there's another test called the metabolic vulnerability index. It's got a glyc-A, which is really a conglomeration of about 5 different early phase metabolites that are very sensitive to inflammation that you can actually look at and say, hey, if this number is really big, we have a problem. It's just never ran by the medical model, or some subspecialties might run it if they're aware of it. It's part of my standard protocol. And so what separates us different is the neurological exam and the fact that we address the metabolic issues as well. And then we look at problems with gluten. We look at leaky gut, the inflammation of the GI tract. We look at autoimmune problems. We look at embedded infection problems. And these are all from Cyrex, arrays 2, 3, 5, 10, 12. Array 10 is all about food issues. Now, there's a lot of argument out there that, you can't tell a lot from it. Yes and no. I do agree that if you're just going food by itself, there's not a lot you can get from it. But when you take an array 10 with food and you see what the body's reacting to, another test we use called a mediator response test. And the mediator response test is the innate immune system. Is it responding to some of the food you're eating that's creating inflammation? And so we begin looking at, because food is your number one antigen you're exposed to all the time. You just don't always know if the food is causing inflammation, or is it your body is responding and it's trying to protect, giving a neuroprotective approach to the food. But the only way to find out is to look at these 2 tests, take the high markers, and take the food out for X amount of time, and then slowly reintroduce food back in. You can begin finding which food is okay to eat and which are not okay. Because if you're eating food that's constantly inflaming the body, it's really hard to get well. And one of the things we've seen is that if we get rid of the inflammatory foods like gluten, and gluten loves to cross-react to dairy, you start seeing thyroid problems calm down and maybe even go away. Or gastrointestinal issues start going away because gluten and dairy create leaky gut. If you get a leaky gut, you get a bacterial change in the gut. The brain can suffer because of the vagal nerve, cranial nerve 10, which fires down into and senses what's going on in the gut. But that's a pathway back to the brain. These pathogens can climb right up these nerves and hit the brain. You get all kinds of weird stuff going on in the body, and everybody's different. So we have to really address the lifestyle and be able to look at these different questions. And that's what separates us, is the fact that we do ask these questions. Is there anything going on with these processes we need to be aware of? Another test that can give us insight is a GI map. Take the stool samples. We can see and get the reports on them. You can see what the very makeup of your GI tract is doing. Are the colonies a good healthy kind, or do you have small intestinal bacteria? Do you have small intestinal bacterial overgrowth that's creating problems, that's inflaming the gut? It has to be addressed. A lot of clinicians don't address them. The only reason why is it drives up cost. Is the cost worth getting a deeper answer so that you get rid of the condition? And I would tell you that it's worth the investigation. There are workarounds if a patient doesn't have the budget for it, but at least you have to make the choice and be exposed to the information so you can make an informed decision of that. And so that's what separates us different, is an in-depth neurological exam and the in-depth blood work that we do and the different types of tests we do to look at the clinical presentation. Because you don't have one, you might have 4 or 5 different presentations, and you have to have those labs to see where they're coming from and all the different problems that are presenting to the body, so you can handle all of them in a way that nurtures the body back to health gently. And then have an MD, and in this clinic we work with the MDs that can help with the removal of medications, and if it makes sense to do so.